Dr. Daniel Amen is a psychiatrist, brain imaging expert, best-selling author, and medical director of the Amen Clinics. He has pioneered the use of brain imaging in clinical psychiatric practice and is a noted expert in the field of the brain and behavior. Dr. Amen's breakthrough research and insights provide hope and more effective treatment for millions of people today.
There are many people who are anxious or depressed or obsessive, prone to anger, they have attentional problems, and they thought their problems were all in their head, purely psychological, if you will. In the research that I've done, what we found is that these and many other problems are brain-based problems, and that when we optimize the brain, their lives become better. We often say, you know, change your brain, change your life, and that's what we've seen. So, welcome. Very strange for me to be back here because about 27 years ago I was a student here, and it was a great place to go to school. So when I had the opportunity, I took it because I think psychology students should know a lot about the brain, and they don't. And it's not part of the curriculum. I think when you sit with your clients, when you sit with your patients, when you sit with your instructors, you should be thinking about their brains. And you should be thinking about how their brains work. And that's what we're going to talk about for the next 14 weeks or so. Brain is the hardware of the soul. You know, the 1990s was the decade of the brain. The first George Bush declared it the decade of the brain. Scientific American recently dedicated a whole issue to building a better brain, looking at brain science as it relates to behavior. Just a little bit about me. I graduated in 1978 with a degree in biology from Vanguard. So anybody who has taken Dr. Lawrence, I suffered before you. I don't know if Keith Ewing's doing any classes. Keith is one of my professors. He's amazing. I thought he was just really great. This is a wonderful place to go to school. I've been extremely blessed by being able to come here. I then went to Oral Roberts University, where I was in their charter class of the medical school. I was in their first medical school class. Me and 15 other kids, and we had like 60 teachers, so you had to go to class. And it was a wonderful experience. It, at the time, was the only Christian medical school in the United States. We learned how to pray with patients, and we really learned medicine in the context of a loving Christian environment. It was really wonderful. I then went to the Walter Reed Army Medical Center in Washington, D.C., where I did my adult psychiatric training, which was really wonderful. I taught a class to chaplains and psychiatrists called Integrating Spirituality and Psychiatry. You'll learn a lot about Freud. Freud was an atheist. Freud is not a good model for us. I mean, he had some interesting ideas, but he definitely wasn't a good model for us, because the fact is 70% of the clients you see will have fundamental religious beliefs that are important to them. So it's critical that you know about that and that you take a history for it. Do you go to church? What do you think about God? How does God interact with your life? It doesn't mean you have to agree with everything they say. Your job, in part at least, is to understand them. So that was a helpful class for me to do. And then I did this wonderful thing. I did a child psychiatry fellowship in Honolulu, Hawaii, at the University of Hawaii. And the Army has a hospital there called Tripler Army Medical Center. And so I'm an adult psychiatrist, but I'm also a child psychiatrist. I've written a couple of books. You have them. And I got to require you to get them, so that was sort of fun. We have 3 clinics where we actively do psychiatric medicine and brain imaging work, and in March we will have our 4th in Washington, D.C. So the work that we do, some people think is pioneering. I think it's just fun. We've been doing brain imaging work for the last 13 years. We have the world's largest database of brain scans related to behavior. So as we talk about this, I mean, it's not like I'm basing this on something I read in a book. It's something that we've seen day in and day out for a long time. And I also work at UC Irvine, where I'm a assistant clinical professor, and I teach residents brain imaging. I teach them about brain injury, ADD. We do hypnosis and biofeedback. Those are my classes to teach. And some people, I was just back here for my 25th anniversary, and one of my colleagues go, "Oh, hypnosis, aren't you opening somebody's mind to the devil?" And I went, "I resent that. I said, I've never opened anybody's mind to the devil. People are in hypnotic trances all the time." It's a very helpful clinical tool to use to help people relax, but also to help people get to deeper sources of information. So, of course, you could probably, you know, if I was interested in doing something bad with it, I could. But the fact is, you can't make somebody do something under hypnosis that they wouldn't otherwise do. I mean, you can't make them kill somebody, or you can make them act funny if you go to stage hypnotists. Anybody seen a stage hypnotist? I mean, they're pretty funny, but clinically, it's a very helpful technique. So maybe we'll talk about it. All right. So I want to start with this story. This is a real story. Actually, all the stories I'll tell you are real. I usually change their names. But Tommy came to see me from Orlando, Florida. Change Your Brain was a New York Times bestseller and is in 12 languages. So we see people from our clinic from all over the world. Well, Tommy came from Orlando, Florida. And as I walked into the clinic, my office manager said, "Dan, you have to meet Tommy." I was tired and distracted, and I said, "What?" And she said, "You have to meet Tommy." I said, "How come?" She said, "He's 9 years old. He's read your book, Change Your Brain, Change Your Life." So now I'm beginning to pay attention. She said, "He sleeps with it." And now I'm thinking he's a weird child. And so I went and found where he was, and he was with our historian. And so I shook his hand. I said, "Hi, Tommy, I'm Dr. Amen." His eyes got really big. He said, "Dr. Amen." He said, "I have a left temporal lobe problem." I said, "Really?" I said, "How do you know that?" He said, "I read the book. I took the checklist in the book." Because all the books have pretty cool checklists. The checklist I passed around earlier. I said, "But how do you really know that?" And he got very thoughtful, and he said, "I have a really bad temper, and I don't want to have a bad temper." And you say people with bad temper sometimes have temporal lobe problems. I said, "Okay." And he said, "And sometimes I see ghosts." So what do you mean you see ghosts? He said, "I see these green things float in front of my eyes. I used to think they were ghosts, and they would scare me. But after reading the book, I realized those were illusions that are common in people who have temporal lobe problems." Wow. And then his eyes got really big, and he looked at me and he said, "And last year, to get rid of all the bad thoughts that I have in my head, I tried to kill myself." And you say in the book that often suicidal behavior is associated with temporal lobe problems. So I'm like blown away by this kid. I said, "Have you seen your brain?" He said, "No." I said, "You want to see it?" He said, "Yeah." So behind me are two SPECT studies. The image on the left is a healthy scan. And here we're looking up from the bottom. So the top is the front part of the brain. The bottom is the back part of the brain. Those two large structures coming out in the middle are called the temporal lobes. I will bring a brain model for us, and we'll play with it and work with it and really understand it. So the image on the left is a healthy brain. Look at the image on the right. It's Tommy's brain. And if you go down about halfway to the right, you see it looks dented in. Well, that is his left temporal lobe. 9 years old. Predicts his own scan. Wow. So, if a 9-year-old can really understand this, can it really be science? I love this cartoon from Peanuts. Peppermint Patty says to Franklin, "What are you reading, Franklin?" And Franklin says, "It's a book on psychology. From what I understand, it seems to be pretty good." "Forget it, Franklin," Patty says. "No book on psychology can be any good if one understands it." That's not what this class is about. This class is about you understanding what the brain does and what happens in certain parts when things go wrong. That's what it's about. Okay? So and if Tommy can do it, you can do it. All right. I want to go over 9 basic ideas that sort of our work is based on and that I want you to be able to explain to your clients and patients. And on the surface, it's going to sound very simple. But when you get to the 9th one, you're going to see it's really powerful. Okay? So the first principle is this. Your brain is involved in everything you do. How you think, how you feel, how you act, how well you get along with other people has to do with the moment-by-moment functioning of your brain. So after looking at 19,000 scans, I've come to believe your brain is heavily involved in the kind of parent you are. Are you the kind of parent that's like my mother? Firm, kind, consistent, loving, predictable. I mean, I'm blessed. I have like one of the world's best moms. I mean, she's predictable. Her brain works well. In fact, the healthy brain I showed you was my mother's brain. Right? It's very sick. I dedicated my book, Healing the Hardware of the Soul, to my mother because out of the 19,000 scans I've done, she has the best brain. Although I told her it wasn't very helpful. I dedicated the book to her. I signed one for her. I said, you know, it's not helpful being raised by a woman with a drop-dead normal brain. And she got this very pouty look on her face. And she said, what do you mean? I said, you're always on time. Dinner was always amazing. I never once heard you yell at Dad, and my father's difficult. When we talk about the cingulate gyrus, I learned about it from him. I said, you didn't at all prepare me to be married. I said, I sort of thought everybody was like you. But what if you have a parent that's different, that's irritable, that's unpredictable, that if things don't go her way or his way, they explode. Right? That has to do with brain function. Now, part of it has to do with modeling, right? And sometimes it has to do with choice, not always, sometimes. It has to do with how their brain works, or how you are in a romantic relationship, or an employee, or an employer. I mean, our clinics, we employ about 55 people, and I can tell if somebody has frontal lobe problems or not. The person who has frontal lobe problems, they're always 7 minutes late to work. It's like they don't start getting ready for work until they're late. It's like, what is this? Right? You can always sort of tell. Or the person who has to be in conflict. You ever met anybody like that? It's like, no matter what, they're picking on the negative, and they're fighting with people, which we think is a way to get their brains stirred up. Right? So, principle number 1, your brain is involved in everything you do. The second principle, again, is very simple. When your brain works right, you tend to work right. And when your brain is troubled, you tend to have trouble. These, again, are 2 healthy scans. The image on the left, the healthy scan. The image on the right is somebody who used heroin for 20 years. Now, you will really understand what all these images mean as we go through the course. But you can see all those holes usually means bad activity, right? Now, it doesn't mean no activity. What it means is overall severely low in activity. Do you think the heroin addict has any possibility of being that person they really are inside? I don't think so. Why? Because they don't have full access to the organ that helps them be their best self. Another example, I'll show you some pictures of Alzheimer's brains. Anybody know somebody who has Alzheimer's disease? Yeah. I mean, is she her full self? No, I mean, they don't even recognize sometimes their own children. They get lost. They have bad judgment. There's terrible memory problems. It robs them of their personality. Now, this is very important for you to know. This would be a question on a test. The brain is the most complex organ in the universe. True or false? True. There's nothing as complicated as the human brain. Nothing. It's 3 pounds, so it's 2% of your body's weight. It uses 25 to 30% of the calories you consume. So it uses most of the energy that you eat. So do you ever wonder why people gain weight as they age? It's because they stop learning. They stop thinking. Lifelong learning is a prevention strategy for Alzheimer's disease. Right? You want to lose 10 pounds? Learn something new. Keep your brain active because it uses so many of the calories that you consume. It's estimated we have 100 billion nerve cells in our brain. I can't even tell you. I mean, that number is just so massive. But each nerve cell or neuron or brain cell, same term for the same thing, okay? The cells in the brain that sort of make things happen, okay? Each nerve cell is connected to other nerve cells by up to 40,000 individual connections between single cells. Okay? Up to 40,000 individual connections. If you do the math, what it means is you actually have more connections in your brain than there are stars in the universe. It's complicated. I mean, if it's going to control things like personality, like art or worship, you would expect it to be complicated. The human brain is larger as a percentage of body weight than any animal on Earth. Especially the cortex. The cortex is the outside surface of the brain. Cortex comes from the Latin word for bark. You know, it's sort of like the outside surface. Except for us, it's a lot more important than bark. All right. Is everybody with me on these first 3 points? I mean, it's pretty simple, right? This next point is very important. Simple, but it's crucial. The next point is that your brain is very soft. We don't think about that. When I dissected them in the anatomy lab, they're sort of rubbery. It's not how they are in life. That's how they are once you fix them in formaldehyde. In life, your brain is as soft butter. Some neurosurgeons think it's really more like a raw egg. We just finished a study on something called omental transposition, where we took the omentum from your gut. It's a fatty organ that lays on top of your intestines that makes neurotransmitters and nerve growth factors and blood vessel growth factors. It's very cool, almost like a second brain in your gut, but we took the omentum, stretched it, took it out of the belly, stretched it, kept it attached to its blood supply, and then put it on the brains of people who had Alzheimer's disease. And what we found, and I'll show you some of these slides when we do the Alzheimer's part, is it actually increased blood flow and activity in the brains of people who had pretty severe pathology in their brains. Well, how exciting is that? Well, I got to see that, you know, the brain is like pulsing, and it's living, and it's really soft. And it's housed really hard skull. And the skull has ridges in it, which means mild traumatic brain injury can change people's whole lives. And nobody knows about it because virtually nobody looks. You have bad behavior, we think about sending you to jail. We don't think about sending you for a brain scan. We don't think about sending you for a neuropsych evaluation. It's like, you're a bad person. You need to, like, go pay for your sins, so to speak. It's very sort of Old Testament, if you will, our sort of judgment issue. Brain is soft, skull is really hard. And sometimes you can have, and this is going to make some people nervous, you can have a severe brain injury and have never lost consciousness. Consciousness is not a good measure of how severe the brain injury is. Why? Because consciousness is a brain stem phenomenon where you might hurt the thoughtful, thinking, impulse control frontal lobe and never have lost consciousness. And some of you go, well, I don't believe that. Well, let me tell you about this case that some of you may have already heard about. It's the most famous case in neurosurgery literature, but I'll tell you, as Paul Harvey would say, the rest of the story. Phineas Gage was a railroad construction worker in 1848. Phineas Gage was a foreman. He worked for the Burlington and Rutland Railroad, and his job was in explosions. They would explode out rock so they could lay railroad track. Phineas, how they would do this is they would use a pickaxe to dig a hole in the rock, then they would put gunpowder in the hole. And then they would lay a fuse in the hole, put sand on top of the gunpowder and the fuse. They took this long 3.5-foot iron rod, it was called a tamping iron, that was at a point at one end and about 2 inches at the other end. They'd use the big end and they'd pack down the sand so they'd get a really good explosion. And then they would light the fuse and run real fast. And then they'd explode out the rock. Well, one day, Phineas Gage had the wrought iron between his legs, and he was putting in the gunpowder in the hole. And he dropped the iron rod into the hole. And the iron rod caused a spark, and then caused an explosion. And then the iron rod acted like a missile and went underneath his left cheekbone, behind his left eye, took out his left prefrontal cortex, and landed 50 yards away. And he's sitting there. And he went to his friend, "Did you see what happened?" with blood going down his face. And he got up to walk to the doctor. And his friend said, "Maybe you should get in the wheelbarrow." And they wheeled him a half a mile to Cavendish, Vermont, where he was. And the doctor saw him. Can you imagine if you were the doctor? He lived. No loss of consciousness. Do you think that accident had an impact on his life? 6 months later, his picture is in the paper in Boston as a miracle cure. They had declared him cured. And he went back to work, where he got fired. And why did he get fired? Because he would make plans and then not follow through on anything. They wouldn't let him be around women because he cursed so badly. He was not responsible anymore. He went from job to job. Went to South America, where he was a stagecoach driver. And then, like many of these people do, where did they migrate? Well, ultimately, he migrated to California, where he died just south of San Francisco 11 years later. And his doctor, John Harlow, had said that Phineas Gage was no longer Phineas Gage after the accident. Right? We don't think about it. And, you know, now it's like the NFL playoffs. Yes! Kill him! Right? I mean, Green Bay and Philadelphia, and I mean, all the games that we watch. Did you see the article in the paper? Anybody see the article in the paper with the level of brain injuries people play football? This is high school football. These aren't these big animals in the NFL. This is high school football. It's estimated that people get hit 30 to 50 times a game in their head. Some of them with the force that is greater than a severe car accident. What they did is they put crash dummy sensors in the helmets to see what level of G-forces they would get 30 to 50 times a game. You think I would encourage my children to play tackle football? That does not demonstrate that you love their brain. This is the goal of this class, is to teach you not only to love your own brain, but to love the brains of the people you love and of your clients. Loving the brain is important. And we do not respect. I mean, maybe you can help me with why in our society we don't even think about it. Hey, my kid, you know, he's playing tackle football and he got a concussion, but he went back in the fourth quarter. I mean, we wear that like a bicep. You know, yeah, he's a man. Am I wrong on this? Or we encourage them to play soccer. What a great game. And then they're hitting soccer balls with their head. How stupid is that? I was on The View a couple of years ago with Barbara Walters and Star Jones and Meredith Vieira. And Meredith and I got on a fight on national TV because she read Change Your Brain and she said, you know, you think that the kids probably shouldn't play soccer, right? Well, my kids play soccer and they think you're lying about the head injury stuff. I said, really? I said, am I lying about the brain is soft, the skull is hard, the brain's important? What? Soccer balls are not light. They're not volleyballs, right? And think about a soccer ball when it's raining or when it's wet, and it's really heavy. I had one of my patients, he came in, and write this down. When you do an evaluation of your clients, ask them about brain injuries 5 times. It's critical. Because you ask people about brain injuries, they forget. If you just ask them once, they'll go, no, and you won't even think about it again. You come to my practice, we'll ask you 5 times. It's because of our experience. Our paperwork asks you. We have a long intake form, people. If anybody wants to see it, you can just download it from our website at amenclinic.com. The intake form asks you, our historian asks you, and if you say no, he or she will ask you again. Are you sure? And if I see no, 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 I'm going to go, have you ever had a brain injury? And if you say no 4th time, I'm going to go, are you sure? Have you ever fallen out of a tree, fell off a fence, dove into a shallow pool? You cannot believe the number of people who say no 4 times, who then remember them. I saw a scan that looked like he had a brain injury. There's a big dent here in the front part of the brain. And the guy said no 5 times. And I winked at the doctor. I said, watch this. I said, you're sure? And now the guy's getting irritated because he thinks I'm over-focused on brain injuries. I said, ever in a car accident? No. Ever play sports? Yes. What did you play? Football. Ever get your bell rung? No. Yes. And then he just got this faraway look. I said, what happened? He said, well, I played at San Diego High School. We had this crazy coach, and we lost this one game really bad. And the coach made us do this drill where we would get 20 yards apart. He was doing this to toughen us up. We would get 20 yards apart, bend over, run full speed and bang helmets. He said, after that happened, I was sick for 3 weeks. I had headaches, I threw up, I was dizzy. Do you think that counts? Same doctor I'm training. The next day, the same sort of thing. Guy says never had a head injury. His scan shows pretty severe head injury. You sure? Never. Ever in a car accident? It's a good question to ask because people forget they were in car accidents. No? Did you play sports? Yep. What did you play? Soccer. Ever have a head injury? No. Ever get your bell rung? And he started to say no, and then he went, we had this crazy coach. He said, we lost this one game, 13-0. He said, that's a bad score in soccer. The coach was so mad at us, he made us do headers for 2.5 hours straight. He said, we were all sick, and the coach got fired. He said, do you think that could cause a brain injury? I'll give you one more example. This is a guy that had Tourette's syndrome. Do you know about Tourette's syndrome? It's a tic disorder where people have both motor and vocal tics. And he was at the drug treatment center here at Hoag Hospital. And they brought him over for a brain scan. And he had this huge dent in his left frontal and temporal lobe regions of the brain. He didn't want to be there. He was sort of in detox. It was pretty irritable. And he said no 5 times. And he not only said no, he used four-letter words to say no, because people with Tourette syndrome often have this thing called corporalalia, which are using bad words. And now he's angry and he's swearing. And are you sure? Blank. No! And he's a little scary. But, you know, did you play sports? No. Ever in a car accident? No. And he's swearing at me. And then he looks at me and he said, does a motorcycle accident count? I said, what happened? I said, well, I was riding my motorcycle around a lake and a deer came out in front of me. And I spilled the bike onto my left side and I wasn't wearing a helmet and I broke my jaw. He said, you think that could have anything to do with it? Yes. They forget. I mean, see, his diagnosis was like antisocial personality disorder, drug abuse, and Tourette syndrome, which sort of meant, you know, he was like a bad person, when in fact he was brain damaged that nobody understood. You got to ask about brain injuries, and you can't just do it once. You got to do it until you irritate them. Now, if they never had a brain injury, fine. Right? And not all brain injuries cause severe brain damage, because your brain goes through healing mechanisms. Your brain has its own healing mechanisms. There's a gene that predisposes you to damage if you have a brain injury. It's called the APO, lipo, L-I-P-O, so apolipoprotein E4 gene. You'll learn a lot about that gene in the course because it's also the gene that predisposes you to have an Alzheimer's disease. If you have this gene and you have a brain injury, you now have a 10 times greater risk of having Alzheimer's disease. Apolipoprotein E4 gene. Okay? So if Steve Young, who's a quarterback for the 49ers, had 8 concussions, and he has the gene, well, likely now he'd be in jail, not on ESPN. So it's not just the injury, it's how the injury relates or how it interfaces with your own genetic makeup. Okay. Mild traumatic brain injury matters. The next principle is certain parts of your brain do certain things or are involved in certain behaviors. That's what a lot of this course is going to be about. But this is not terribly new, right? I mean, you just get a neuropsychology book. The book that we're using talks about the prefrontal cortex, the front part of the brain. Talks about what it does. We will talk about it. The temporal lobes, the cerebellum, the occipital lobes, the parietal lobes. Certain parts of the brain do certain things. The next principle, so before I talk about it, let me just give you a little bit of orientation words that we will talk about through the course. Superior means toward the top. You know, if you're superior in your field, you're toward the top of your field. Inferior means toward the bottom. So superior would be toward the top of the brain. Inferior would be toward the bottom of the brain. Anterior means toward the front. So an anteroom in a house is a room toward the front of the house. Okay. Posterior, toward the back. Dorsal means toward the top, like a dorsal fin on a dolphin. Okay. Ventral means toward the belly. A couple of more. This is looking underneath the brain. And so anterior would be toward the front, posterior toward the back, lateral toward the outside, medial toward the middle. So these are sort of directional words that are important to know. Okay, so if we go back to our last principle, that certain parts of your brain are involved in certain behaviors, the next principle sort of makes sense, is that problems in specific parts of your brain tend to cause specific problems with behaviors. So if you have damage to the executive part of the brain, part we call the prefrontal cortex, you're likely to have executive problems. Now, it's not 100%, because certain parts of your brain can sort of take over other functions depending on how early the trauma happened. Okay? But by and large, you have a problem in your parietal lobe, which is what happens in Alzheimer's disease, you're going to have trouble getting home, because the parietal lobes are heavily involved with creating visual maps in your head. We will talk about that. Okay. The next principle is that most psychiatric illnesses are not single or simple disorders. Most psychiatric illnesses are complicated. There are multiple types of depression. There are multiple types of anxiety disorders. There are multiple types of ADD. There are multiple types of bipolar disorder, antisocial personality disorder. There are multiple types. And most psychiatric disorders do not exist in a vacuum. The DSM-4 talks about them in wishful thinking terms. This is major depression. 75% of the time, it exists with an anxiety disorder. So the average number of people who come to our clinic, the average number of diagnoses of people who come to our clinic is 4.5. In the real world, people are complicated. So if you have somebody that you're treating with PTSD, it's very common they've had a brain injury because maybe Pop threw them against the wall as well. They may also have a substance abuse problem. They may also have a learning problem. And it's just important when you are evaluating people, you don't go, oh, you're depressed, take Prozac. Or, oh, you're depressed, we're going to do cognitive therapy with you. You just want to make sure you have a good way to evaluate everything that might be there. And they're complicated. We'll go through the different types of the major disorders. The next principle, hopefully I'll convince you of that, but I certainly convinced myself of this, is that if you look at the brain, it's really helpful. You know, psychiatrists are the only medical specialists that never look at the organ they treat. Why is that? I mean, if somebody could help me, I'd be happy to hear it, but it's a problem. It's held psychiatry back. And in large part, it has to do, I think, with psychoanalytic thinking. Psychoanalytic thinking, we got away from being sort of medically oriented physicians and into the realm of religion. Because psychoanalysis is a religion where people, they make up new words, they have these belief systems, and if you don't believe a certain way, they'll extrude you from, you know, sort of the core body of believers. And, you know, it really, I think, impaired science for a long time. Imaging helps. We'll talk about why as we go through the course. And the most exciting principle is that your brain can change. Is you're not stuck with the brain that you're born with. I mean, say you have bipolar disorder in your family, and you have a tendency to be sad, blue, moody, irritable. And we scan you and we see all these hot areas in your brain. Well, we could do things about it. And we have many before and after scans. I'll probably show you 100 of them before the course is over. And it's so exciting because we can balance brain function. We can do it with medicine. We can do it with supplements. We can do it with certain kinds of psychotherapy. We can do it with exercises. We just finished a study on meditation. Seems to help balance brain function. But you want to know what you have and then work as hard as you can to optimize it. Why? Because going back to the second principle, when your brain works right, you work right. When your brain doesn't, there's trouble. Okay, questions? Any questions? Does anybody have trouble with any of the 9 that we should talk about? If you memorize them and you share them with your clients, they'll sort of get that their brain's important. Now, why do you want them to get their brain's important? So they'll start loving it. So they'll start caring about it. They'll start thinking about it. We have this very cool poster. Bree, if you'll remind me, I'll bring everybody a poster next week called Which Brain Do You Want? Which is a healthy brain that is surrounded by drug-affected brains, from a heroin brain to, I don't think a heroin brain's on, marijuana, alcohol, cigarettes, cocaine, methamphetamine. It's not healthy for your brain. But if they never learn that it's important to love their brain, it's like, I feel better when I smoke pot. It relaxes me. I feel less I mean, how often do I hear that? All the time. They're using it as what? They're using it as medication. They're self-medicated. If you don't help change their brain, they will try to change it on their own. And they will try in many different ways. Right? Okay, so just some thoughts on this question, why are psychiatrists the only medical specialists that never look at the organ they treat? It's not part of their training or their tradition. Most don't know how to read the images. You will learn how to do that through the course. And most people think brain problems must be so obvious, like this guy, in order for them to think about a brain problem. Anybody remember this picture in the paper? This was a construction worker who was on a ladder with a drill that had a long drill bit. And he fell. And he fell onto the drill bit. And the drill bit went through his right eye. He's very fortunate because it pushed his brain to the side and it went out the back of his head. Can you imagine what he would have said to himself as he got up and walked by the mirror? Can you imagine if you were the emergency room doctor and this guy walked into your emergency room? And you know what happened? The neurosurgeon who came down started playing with it, and he unscrewed it. Out! He's so lucky that he didn't rip a blood vessel and kill this guy instantly, but he didn't. This man is truly blessed. And I have this cool picture to show you. But most psychiatrists, so just because you send somebody to the psychiatrist for like medical management, you know, if he's not well trained, he's going to like not even think about the brain unless the problem is sticking out of his head. Okay, so it's time to change. Our tradition is changing. The brain is our organ. There are thousands. I don't want anybody coming back and go, oh, you know, Dr. Amen, the last 3 years there's been no biological studies on depression. I mean, if you do that, it'll be very bad. Because there are thousands and thousands of imaging articles. Now, for your paper, you don't have to just do imaging articles, even though I'm interested in it. But, you know, something to do with the biology of it, the physical aspect of it. These are the different kinds of imaging studies that are available to neuroscientists. There's something called an EEG, which measures electrical activity in the brain. There's something called QEEG, or quantitative EEG, that takes the brainwave signals, puts them through computers, and magnifies them. SPECT, which we will talk about. PET, which you've probably heard about, positron emission tomography, looks at glucose metabolism. And functional MRI. Functional MRI looks at blood flow, as SPECT looks at blood flow and activity patterns in the brain. SPECT stands for Single Photon Emission Computed Tomography. Long phrase that say basically we take a radioactive isotope. Anybody remember the periodic table of elements? Well, number 99 is man-made. It's called technetium. And 99 has self-esteem problems. Because 99 doesn't like being 99. So 99 automatically changes itself to 98. And as it does that, it releases something called a photon. It's That's what isotopes are. Unstable molecules that change shapes. We're all looking for stability. Molecules as well, looking for stability. As it goes to 98, produces photons, which we can actually measure with cool crystals in our cameras. And so we make technetium, combine it with something that's easily taken up by cells in your brain, inject it into your arm. It goes to your brain within about 2 minutes, locks there, stays fixed, and then sends out millions and millions of these photons that we can measure. And that's how we get these pictures. So we're looking at brain activity. The SPECT scan of a dead person is blank. Okay? So an MRI, which looks at the physical anatomy of the brain of a dead person, will look like a brain. Okay? So we're looking at function. And in psychiatry, we probably need to be more interested in function rather than in structure. In function rather than what the brain actually physically looks like. So think about it. Say I take my computer and I drop it. I'm not going to. But say I did that. And say, well, it looks just fine. But I might not be able to turn it on. Right? And most psychiatric problems are not problems of what the brain actually anatomically, physically looks like. It's how it works. And that's why they call psychiatric disorders functional disorders. There used to be this differentiation in terms. Remember this, Jerry? We used to have organic illnesses and functional illnesses. Well, it was really stupid because they're all organic. Organic just means living. You know, it's all organic. Bipolar disorder is not something you get from having a difficult mother. It's, you know, it's a chemical imbalance that causes serious, and having a difficult mother does not help. I mean, let's be clear about that. If you have the tendency for bipolar disorder and you are raised in a family of abuse, you will have your first bipolar break 10 years earlier than if you were raised in a loving, consistent family. So, environment matters. But let us not call bipolar disorder an environmental disorder. Okay. The scans I'm going to show you are really easy to understand. Keep it very simple in your head, because we look for three things. Areas of the brain that work well, areas of the brain that are underactive, and areas of your brain that are overactive. Okay? Good activity, too little, or too much. And the goal of treatment is balance. So if you have a hot brain, you want to calm it down. A cold brain, we want to ramp it up, raise it up. So we're always looking for balance. And we want to know what are the medical ways to do that, what are the nutritional ways to do that, what are the exercise ways to do it, what are the psychotherapy ways to do it, the supplement ways to do it. I mean, you want to have like lots of ideas in your head on how to do this. This is what the SPECT camera looks like in our clinic. And we say it has 3 heads because these actually have crystals in them that measure where the isotope is in a patient's brain. So 1, 2, 3. And cameras with more heads can just image faster, which makes it easier. And we actually get better images. Yes, it's very different than an MRI. An MRI where you go in a tube, 30% of people who have MRIs have panic attacks. They don't like it. They get claustrophobic. Well, there's no tube, though. So your mother can stand here and stroke your arm if you need that. It's a much easier procedure. So why would you want to get one? I mean, well, if you had brain injury, that would be one. Or cognitive decline. You're worried you have pre-Alzheimer's disease. You have blood vessel disease, like a stroke. If you have seizure disorders, you're violent or suicidal. You have toxic exposure. Where you live matters. Anybody here from the Central Valley? We have lots of pesticides in the Central Valley. If you live on a farm, you're more likely to have Parkinson's disease because of the toxins. You know, you wonder, you know, there's recent, you know, where are the worst places to live, who dies early, and, you know, I'm looking for Southern California because of all the pollutants. But we're like 29th you know, we weren't at the top of the list at all. But toxic exposure, where you work, matters. I saw one scan not too long ago that looked like somebody who was a heroin addict. I'm like, hey, what drugs are you using? Dr. Amen, I never use drugs. Come on, look at his brain. What do you do? I work in a furniture factory. What do you do in the furniture factory? I finish furniture all day long. Do you have good ventilation? No. Do you wear your mask? I don't need to do that. Yes, you do. I had toxic exposure. Anybody go to a dry cleaners? Do you ever smell the smell in a dry? It's toxic for the brain. Your environment matters. We use it to subtype ADD, anxiety, and depression. And when things aren't getting better, and I'll show you lots of examples of that. So, how we make this picture is we tell the computer we want to see a certain level of brain activity. So we want to see the top 45% of brain activity. Below that will show up as a hole or a dent. So the holes you see are not no activity. They are areas of low activity. Okay? So this is looking at the outside surface. I know you have these. These are some examples from our normal study. And I'm going to make a plea. Can I do this commercial for my normal study? I am of the belief that there are very few normal people in the world. Now, I didn't start out with that belief, but we've been doing for the last year a normal study where we're looking for 200 normal people to scan them so they get a free scan. What we get are normal people we can compare our research database subjects to, like our killers or bipolar people. This is our definition of normal. If you fit it, or if you know anybody who fits it, I would beg you for your brain. Brain scan. Feeling too much like Igor here. Igor, get the brain. No psychiatric illness, no DSM-4 psychiatric illness at any point in your life. Depression, anxiety, ADD, bipolar disorder, substance abuse disorder, no psychiatric disorder. No significant brain injury. Now this is a brain injury where you lost consciousness and it changed your behavior. You know, if you like fell off a horse, but you're fine and it didn't change anything, we'll still take you. No significant substance abuse. Now if you smoke pot 5 times, as a teenager, like, not a big deal. We'll take you. You know, if you have 2 glasses of wine a week, we'll take you. Now, if you're in a drug treatment program, we will not take you. And the kicker is no first-degree relative with a psychiatric illness. Mother, father, sibling, or child. But if your child has something but they got it from their dad, we'll take you. It's critical. We now have 36 people in our normal database, 36 or 37, and we need 200. Because we really want to understand normal at each decade of life. So if anybody is interested, on the website there's the form on what normal is. You can email me, hey, Dr. Amen, I think I fit. Can I come get screened? I think we're paying people about $200 if they pass and go all the way through. The benefit is you have a brain scan that you'll always have. You can say, when I was this age, this is what my brain looked like. So if you got in a car accident, or you had a stroke, or you started having memory problems, you have a baseline study. So it's worth $2,000 because you get 2 scans, rest and concentration. The downside is it takes a little bit of time. It's probably about 7 or 8 hours of time by the time you take all the screening tests. And you get a little bit of radiation, because this is a nuclear medicine study that looks at how your brain works, and we use radioisotopes. It's about the same level as a CAT scan, so it's like a regular medical procedure. So if you're pregnant, you can't do it when you're pregnant. Okay, so this is actually Marina Kolbe's brain. Marina is one of the anchors at CNN International. They did a story on my work in a show called Behind the Mind, which is very cool. And she got scanned as part of it. She had a drop-dead normal brain. It was really sort of cool to see, because these are rare. It's my mother's brain. Oh, I scanned her 3 times just to see. This is a police officer's brain from Houston, Texas. He's a bodybuilder. He's smart. He's sweet. He's funny. I mean, it's just normal. Now, remember what I said. We look at good activity, too little, or too much. This view is what we call the active view. We're looking at the hot spots in the brain. Here, blue is average activity. Sometimes you'll see this as gold. And red, or what you may see as white, is the top 15% of brain activity. So it's the hot spots. And the hot spots are usually in the back part of the brain. The back part of the brain, back bottom part of the brain, is called the cerebellum. Cerebellum is Latin for little brain. It's the little brain in the bottom. And why would that be the most active part of the brain? Anybody know? It is the conductor, you bet. It has half of the brain's neurons. It's heavily involved with motor coordination and thought coordination. And as we'll see, it's like processing speed on a computer. How quickly you can learn and integrate new information has to do with cerebellar function. We find it low in autism. We find it low in ADD. We find it low often in brain injuries. So if you're sort of thinking slow and feeling tired, your cerebellum might be low. Normally, it is the most active symmetrical part of the brain. So looking at it like this. Now, this is just a four-orientation view. We're looking up from the bottom, down from the top. This is looking at the left side. That's looking at the right side. So you're looking at the same thing 4 different ways. But basically, the back is really active. And that's what we see in our healthy brains. The back is really healthy and happy. And the front is sort of cool. When the front is hot, you worry too much. You think too much. You can't stop. It's a bad thing. Most of the time. This is somebody who had a stroke. Now, strokes occur when an area of the brain gets no blood flow. And it can occur for 2 reasons. A blood vessel breaks, and it bleeds all over the area, which is toxic. But then, because the blood vessel is broken, it doesn't get new nourishment, can't heal. Or you get a blood clot that may be thrown from your heart or thrown from one of the blood vessels in your neck, and it goes and it closes off a blood vessel. And so the tissue beyond that is now dying. Because if your brain doesn't get blood supply, cells start to die within 4 minutes. So this is a stroke. And you see the huge hole of activity. Now, this is not low activity. This is no activity, because this is where tissue has actually died. This is Alzheimer's disease. And what we see in Alzheimer's disease is bilateral decreased parietal lobe activity, top back, bilateral decreased temporal lobe activity. Now that we're getting into yet another election year, I often ask this question: should we scan presidential candidates? What do you think? What would the advantage be of scanning presidential candidates? Yeah, you'd want to see how their memory function. You bet. You want to see where their hot spots are? Clinton probably had a few. 3 out of the last 5 presidents have had brain problems. President Reagan had Alzheimer's disease in the White House. That is a national crisis. When he said he didn't remember the Iran-Contra affair, I totally believe him. Now, I don't believe he wasn't in on it, but he probably forgot it with the Alzheimer's disease, right? And I don't know what you think about President Clinton, but he clearly had frontal lobe problems. He had issues with judgment, impulse control, excitement-seeking behavior from the Oval Office. I don't know what you think about President Bush, but I think this next election, we should see President Bush's picture and a picture of his scan. And we can see how much alcohol and cocaine he did. It's not a big secret. I mean, he had DUI, right? Maybe that's why he mixes up words. I don't know. And then we'll see, you know, maybe he's going to run against Howard Dean. So a picture of Howard Dean, the doctor, and a picture of his brain. And we can see why he has a bad temper. You know? Is it like something we should be concerned about? Or, you know, he just has enthusiasm for what he wants. Because a guy with a bad brain can cost millions, maybe billions of people their lives. What do you think the brain of Saddam looks like? Anybody know Saddam's history? It's actually fascinating. I wrote about it this week in Brain in the News. Saddam's father died before Saddam was born. So during the pregnancy, his father died. His mother had severe episodes of psychotic depression, including multiple suicide attempts. Saddam was not raised by his mother for the first 3 years. He was raised by family members. So there's this whole bonding developmental issue that Saddam clearly did not have. And then when he went back to live with his mom, who was depressed, and her new husband, he was psychologically and physically abused. Now, we say, psychologists say, who study this sort of thing, is that Saddam has a condition called malignant narcissism. Nothing matters but him. Well, you get that with no bonding. Right? They also say he's paranoid. Well, no kidding. After you kill that many people, you should be paranoid. But that can come from clearly abnormal brain function. Right? So he's actually a good example of where the brain interfaces with the development. Some examples of brain injuries. We'll talk a lot about them during the brain injury lecture. But the image on the left is what we call a contra coup injury. Because you know your brain is in a closed space. So if you get hit here, you'll get a bruise on your brain there. But then your brain has nowhere to go. So what happens to it inside your skull? Just like why is shaking a baby bad? Because their brain is going like this, and it can increase the chances they'll have learning disabilities or ADD or behavioral problems. So here, damage to the front, damage to the back. Here, wiped out the left front side of the brain. And the one on the end, you look at the temporal lobes, they look like they're bashed in on the inside. Was a girl who was a college student it was raining out and she was walking down a metal ramp, slipped, and head first went 20 feet into a metal pole. Unconscious 10 minutes. That was it. Changed her whole life in a negative way. So, wear a helmet, stay off the roof. Don't let your kids do dangerous things. And if you're snowboarding without a helmet, let's think about this. Okay, real reason not to do drugs? We'll talk about this. We'll have a whole lecture on it. But the real reason is they'd hurt your brain. These are my patients: cocaine, methamphetamine. It's not healthy. And it's not just our work. I mean, there's like 114 imaging studies on drug abuse in the literature. And they look at things like alcohol. Not that good for your brain. But Dr. Amen, my cardiologist says I should have a little bit of alcohol. Good for my heart. Yes, you may live longer with a little bit, but you won't be very smart. New research out of Johns Hopkins, you know, even small amounts of alcohol shrink the brain. It's toxic. Heroin, not that good for your brain as you might expect, but you know what else does this? Methadone. What is methadone? The most common treatment for heroin addicts. Keeps you cognitively impaired. You know what else does this? Pain pills. Vicodin, OxyContin. You remember Rush Limbaugh earlier in the year? I started Brain in the News after that. It was so interesting to me. You know, he makes a stupid comment on ESPN about McNabb, the quarterback for the Eagles. You know, just a stupid comment that he should have known better. You know, broadcasters have been losing jobs for years by making comments like that. right? Makes that. And then a couple of days later, if even that, we're finding that he's being investigated for writing prescriptions for OxyContin, which is a felony. And then he goes into a drug treatment program. And I'm going, his brain looks like this. That's why he's making stupid comments. Brain in the news. So it just sort of worked for me. I had to write about that. And then Kobe Bryant, Michael Jackson, I'm like, this is heaven. Marijuana is not an innocuous drug. Marijuana damages temporal lobe activity and frontal lobe activity, so people have issues with motivation and memory. And it's really cool if you have the posters that I'll give you, and your teenager's going, oh, it's no big deal, or your 30-year-olds are going, nah, it's no big deal. You can look at it and you go, come on, which brain do you want? And the analogy I like the most is I ask kids what kind of car they like. So do it with me. What kind of car? If you could have any car, now don't think of this as materialistic. For the moment, if you could have any car, what time is it, Jerry? 5:15. Okay. If you could have any car you wanted, what kind of car would you have? Come on. Somebody's got to have a car they would love to have.
A Hummer.
A Hummer. It's the most common response that I get. Most common. And so, okay, let's go with this. So you have the Hummer. It's brand new. You love it. You wash it. You know, you get a new car, you keep it clean for a few months. Wax it. It's in the garage because we're not going to leave it out to the salt air. How would you feel if somebody got into your garage with a box of salt and they poured it in the gas tank? What would you do? I tell you the uniform answer I get from teenagers. What do you think it is? No. Death! I'd kill him! That's what they say. And then I look at them like, so don't you think it might be helpful to love your brain more than the car engine? I mean, be here with me, right? Your brain helps you get dates. It helps you get into the college that you want or the PhD program that you want. Your brain helps you get along, helps you get promoted, helps you worship, helps you connect. Aren't you going to take better care of that than your car? They don't even think about it. So that's sort of what we're going to do, teach people to love their brains. The cool thing is if they stop using, the brain tends, not always, but tends to get better. And whose brain gets better may have to do with the apolipoprotein E4 gene, or probably a whole bunch of other genes that we're going to discover in the next 10 years. It's a very exciting time to be involved with neuroscience. Very exciting. Okay. So, we want to take a brain system approach to understanding our patients. And that's what we're going to do in the course. So I think today, because of time, I'm going to talk about the prefrontal cortex, and then we're going to stop. And next week, we'll get through the rest. Prefrontal cortex is the front third of the brain, largest in humans and in any other animal by far. It's estimated to be 30% or more of the human brain. In chimpanzees, our nearest cousins, it's 11%. In your dog, it's 7%. And in your cat, I hate to say this, because I love my ragdoll cats, 3.5%. They are not filled with forward thinking. The prefrontal cortex is called the executive part of the brain. It's the supervisor. It watches you. It helps you with things like forethought, judgment. Now, there are different parts to the prefrontal cortex. So the dorsolateral, what do I mean by that? Dorsal, toward the top, lateral, outside, dorsolateral prefrontal cortex is thought to be heavily involved with short-term memory. The underside of the prefrontal cortex, we call it the inferior, toward the bottom, orbital, inferior orbital because it's above the eyes. It's a part of the prefrontal cortex, part of the limbic system that's involved with mood and impulse control. So people have low activity in the inferior orbital prefrontal cortex often have depression and ADD and issues with judgment and impulsivity. So if we take the prefrontal cortex as a whole, it's involved with executive functions, and think of it like an executive at a business. I guess we could think about it as Dr. Dempster. It's the boss. Like the boss at work. It's involved with forethought, judgment, impulse control, organization, planning, forethought, empathy, insight. I think of it as Jiminy Cricket. You know Jiminy Cricket in the movie Pinocchio? What was Pinocchio? What was Jiminy Cricket? It was his conscience. He sings a song in the movie. Stop, look, listen, think. That's what the prefrontal cortex does. And in the movie, Jiminy Cricket's job is to help Pinocchio reach Pinocchio's goal. What's Pinocchio's goal? To be a real boy. You bet. And when Jiminy Cricket gets thrown off, does Pinocchio go toward his goal? No, he gets in all sorts of trouble. So think of the prefrontal cortex as that still small voice in your head that helps you decide between right and wrong, that helps you make a goal and match your behavior consistently over time to reach the goal. So right away you can see we're in a hornet's nest when it comes to morality and the whole issue of free will. Because what happens if you take out somebody's prefrontal cortex? You have a Jiminy Cricket deficiency. We do not all have the same level of free will. When I started doing the imaging work, that's what I thought, because that's what I was raised in. And I went, uh-oh. But it came to me very clearly, because I think I have a very strong Christian foundation. It's like, oh, that's why it says in the New Testament, don't judge people. How many times does it say that? A lot. Why? Because it's more complicated than you think. When there are problems in this part of the brain, people have executive dysfunction. Think of the Clinton White House. Late, not on time, disorganized. Interesting. But when there are problems here, short attention span, they're impulsive, they get distracted easily, they procrastinate. Put things off, put things off, put things off, put things off. They have bad judgment. They don't think before they say things. Now, in a way, that's good because you're spontaneous. In another way, that's bad because you don't have friends anymore. Lack empathy and insight. Carl Menninger wrote a book called Whatever Happened to Sin. I wanted to write the afterwards. It's like, because people don't talk about the prefrontal cortex. They're connected to each other. So why do you think Teen Challenge works, besides the grace of God? Anybody ever been involved with Teen Challenge? Teen Challenge is a wonderful group. If you have the opportunity to interface with people who work at Teen Challenge, you should. Teen Challenge works in part. It's a Christian group that deals with drug addicts. It's Assemblies of God. We started as an Assemblies of God group that works with drug addicts. They provide the prefrontal cortex, structure, and rules. And one other thing, a lot of anxiety. Because many people who have low activity in the prefrontal cortex don't have enough anxiety. And is anxiety good for you? Some. You need some, because if you don't have some, you'll do really stupid things. That'll be a theme we will talk about. You need some anxiety. So when the prefrontal cortex is low, think of it as like the boss is not at work. So we see it in ADHD, in schizophrenia. People have antisocial personality disorder, brain trauma, a certain kind of dementia called frontal temporal dementia, and some kinds of depression. When it works too hard, it's like the boss is always there. It's like the boss is a micromanager. They want to know everything you're doing, when you're doing, and you can't get anything done in that either. But that's when it's working too hard. You have OCD, or oppositional defiant disorder, which we'll talk, or anorexia, which is you can't let go. So just a brief example about ADHD. The one on the left is a brain at rest. The one on the right is when they're concentrating. And what we see with ADHD is when people try to concentrate, they get suppressed activity in their prefrontal cortex, which sort of means the harder they try, the worse it gets. You can't sort of, kick them in the rear end and tell them to try harder, because it doesn't work for them. It actually disorganizes them. It's a common sense thing to do, but it doesn't work. On medicine, then you can sort of kick them in the rear end, and it seems to help them. But you have to treat this, because it's a physical problem. Schizophrenia, often really low activity in the prefrontal cortex. This is on and off medicine, so we can see that some of our antipsychotic medicines are really helpful because they help to balance frontal lobe activity. Someone who has what we would call sin in his life, he was running an internet pornography scam, was on trial when we scanned him. He has terrible frontal lobes, like virtually no judgment. And interestingly, people with low prefrontal cortex activity also have low sweat gland activity and slower heart rates than other people, based on research from USC by a psychologist named Adrian Raine. So what correlates with low sweat gland activity? Anybody know? I mean, if your hands sweat, what does that usually correlate with? Nervousness, anxiety. Well, these people have low levels of anxiety. And with low levels of anxiety come really bad judgment. So high levels of anxiety clearly will handicap you. Low levels of anxiety, you won't think about what you say before you say it. You won't think about what you do before you do it. So that'll get you into hot water, too. And that's why I say with Teen Challenge, not only do they give you rules, New Testament, this is how we live our life, they give you a lot of anxiety. What's anxiety called? Or how would they give you anxiety at a fundamental Christian group for drug addicts? Guilt. It's better than that, though. It's better than that. More powerful. Hell, that's close. But it's not even hell. Because hell is like a far-off thing. See, I was raised Roman Catholic. And as long as you could get to confession, before you died, you were good. Jesus forgave the guy on the cross. So, hell, this is like even better. Now, the rapture. Do they talk about the rapture? It's like, hell's not going to happen tomorrow. It's like, dude, you could get left behind today. And they work that angle. I mean, they work it. These kids, they're scared. And they have rules. It's the perfect frontal lobe treatment for drug addicts. Now, it's not great treatment for everybody. Because some people, you talk about the rapture too much, they go around chronically anxious and upset and frozen. So you have to sort of work it to the brain. And you wonder, why are there so many different churches in our country? And I think people tend to gravitate toward what works for them. People have really hot singulates, we'll talk about next week. They like things just a certain way. They don't go to an Assemblies of God churches. They'll go to a Catholic church or a Lutheran church or an Episcopal. They'll go to a church with predictability. You know, if you want a little excitement, you go to an Assemblies of God church. Because that, you know, people are loving Jesus. Out loud! Oh, just some other examples of head injuries affecting the frontal lobes. Okay. We will start here next week. Any questions? You bet. And if they can't hold the information, if they can't pay attention to it, it's really hard. So it doesn't mean they can't learn it, but it may mean you want to evaluate it more and get some more juice, if you will, to that part of their brain so that they can then take advantage of it. That's a great question.